to today's health headlines, recognizing Leukemia Awareness Month by highlighting the latest advances in treatments and the ongoing challenges of detecting this disease early.
Joining us this morning is Dr. Amr Zaidan, a leukemia specialist and chief of hematologic malignancies at the Yale Cancer Center. Doctor, thank you for being with us. Let's start out with the basics of leukemia. How does this blood cancer develop? And are there certain factors that could actually increase a person's risk?
Yeah, thank you so much for the kind invitation. So leukemia actually is a form of cancer that arises from the blood-forming elements. However, leukemia is not only one kind of cancer. There are different forms of leukemia. And generally, we divide leukemias into what we call acute leukemias, which basically develop relatively quickly, and chronic leukemias, which can develop over many years. And then based on the type of the cell, so there could be lymphoid leukemias or myeloid leukemias, depending on the cell of origin. All of these leukemias are relatively rare. They are not common as some of the solid tumors like lung cancer and breast cancers, but they can be quite life-threatening, and it's very important to recognize them quickly when they occur and to deliver the right treatment.
And I know it can be so difficult to detect early. What are some of the common symptoms that people should be watching out for? And what's a red flag that you should possibly go see a doctor?
Yeah, that's a very good question. I think one of the challenges with the presentation or the symptoms is that they are generally non-specific. There are not like single symptom that you can reliably say this is related to leukemia. Some of the symptoms could be general, such as fatigue, general weakness, unusual tiredness. And some of the symptoms are more specific, related to the crowding out of the bone marrow by the leukemia cells, leading to bleeding, infections, as well as recurrent fevers. So in general, the best way to detect it is by doing a blood work. If you do a blood work, what we call the CBC, complete blood count, that generally will show the evidence of leukemia. So in general, if anybody has symptoms that do not improve within a few days by antibiotics, they should really talk to their primary care physician and get some blood work going.
Okay. Doctor, like everything in the medical field, leukemia treatment has seen some major advances in recent years. Can you share some of the more exciting developments in treatment and research and how they are improving outcomes for patients?
Yeah, so while leukemias can be devastating diseases, we have seen amazing progress over the last 10 to 15 years. So we historically have treated leukemias with chemotherapy. However, we have several new modalities of treatment that have risen over the years. The first class is what I would call targeted therapies. So these are drugs that go after the specific genetic alterations that lead to the leukemia. And some of this, like Gleevec, for example, for chronic myeloid leukemia, has almost led to patients living almost normal life with, despite having the leukemia. Other important therapies are immunotherapies, for example, what we call CAR cells or chimeric T cell receptor cells. So those are T cells, immune cells taken from the patient, genetically engineered, and then put back into the patient to fight the leukemia. And those have also resulted in amazing outcomes. And then we have a number of immune antibodies that also can be used to carry specific treatments into the cancer cells. Almost, I tell patients, almost like a drone, so targeted delivery of the chemotherapy agent to the cancer cells. And we continue to see, I think, very good progress. So it's very important for patients to go to centers with high expertise and good volume of patients.
Sure, yeah, and it is so encouraging to hear that there is so much work being done on this here in Connecticut. Dr. Amr Zaidan, I want to thank you so much for your time today. Thank you for talking to us about this.
Have a good day. Thank you so much.